According to the Census Bureau, as the 2012 numbers, 43% of people who receive one or more form of government assistance stay on for 4 years or more. And the majority of it is actually minors who are 18 or younger. So most of us are actually taxpayers in this setting. So we actually don't really know where our taxes are going to and it's being productive. We know when it goes to the military that it's being used productively because of protecting our freedom. But if we use it towards the government assistance, where it's not being, we don't know if it's being productive. So we're going to identify what the problems are and what can be done to fix it. So like I said, the problems is people staying on welfare. That's one of the things we're going to be talking about. Abusing and frauding the welfare is another thing, and also what type of solutions we can do. We can, right now they're trying to talk to reform it. They're talking about drug testing, actually starting implementing drug testing and making it harder to defraud. So problems is, of course, is who gets the welfare, and you can see majority of it is you can see by the numbers it goes 1 year, 2 years, 3 years, 4 years, and you see majority of it is 1 year, and then it kind of goes down a lot from 2 to 3 years, and then 4 years, it's pretty much goes back up. So it says according to the Census Bureau, 50% of people 18 and under receive government assistance to 4 years or more. Majority of them have no education and no father is present as well. According to Edwin Mara from the CNSnews.com, the Inspector General told Congress in 2012 46.3 million recipients have either sold, defrauded, or did something to sell their aid for cash, drugs, guns, and or other stuff. And also the USDA, who administers the SNAP and all that stuff, is not vetting some recipients and giving more than they should, which means that when people come to get their assistance, they're not really checking the Social Security number, the IDs, and all that. So people are actually getting Social Security cards or numbers for people who are actually dead and getting more than they should as well. Like I said, many people who are minors, many people stay on it. People abuse it as well by getting more than they should, telling the government that, hey, this is me, but it's really not them. And then also welfare mistakes, as in, the government is not really double checking, triple checking to make sure that all the stuff gets straight and all that. So like I said, there's a lot of problems with it, not only with people defrauding it, but also on the government's part from not doing what they should be doing in the first place. Different solutions that can be done is drug testing. According to Abby E. Schomburg from the State Drug Testing Requirements of Welfare Recipients, several states have adopted drug testing for welfare patients who have drug or alcohol abuse, or stated by a doctor that they are addicted, which does not violate the Fourth Amendment. Fourth Amendment pretty much says that the government has rights to searches and seizures and all that stuff. So many people, some states are saying that you can't do that, it's violating the Fourth Amendment. But now what they're saying is that, hey, this person has violated the law by drug abuse or alcohol addiction or something like this. So they actually have to do drug testing in order to get welfare. The other one was work for pay. They did that in the past. Works a little bit really doesn't. More restrictions. A study by Holly Child and Dara McCarthy of examining relations between family drug courts and program compliance show that welfare cases with mothers who abused drugs, 55% who went through treatment and were clean, got reunited with their child. Which pretty much what happened was that the drug court said, hey, you got to go through rehab, you got to do this, you got to do that, and then once you do it, you can get your child back. And 55% actually went through it and actually, got reunited with their child and all that. And this was kept just by cases who were drug abusers who were on welfare as well. They didn't do anyone else but welfare. Like I said, more restrictions make it harder to defraud it. According to Kathy Burke of Newsmax, says that the GOP governors push for stricter programs like drug testing, help recipients find jobs, or contribute a little per month for benefits. So pretty much what they did was that, hey, if you want welfare, we'll help you find a job. And everything in some states, or other states said that, if you work and still get benefits, you just pay like $1 or $2 a month, not that much, or Medicaid, and then we'll give you Medicaid or whatever welfare can be done. One of the things that I said that could be done is also possibly give welfare recipients a bank account, kind of, but it's just for welfare recipients. And what they do is they have to show their ID, have to show their card, and then when they swipe the card, you know, it's a specialized card. They can't just go on Amazon and buy whatever. What they have to do is they have to, the food stamps or whatever, the SNAP or whatever is on it, and they have to swipe the card and put it in and all that stuff. They can't actually get the money in hand or get the check in hand and just sell it or to whomever and all that stuff. This right here is a chart saying, who abuses drugs, and you can see that it's kind of significant, but not really. But it is that more people receive welfare actually abuse drugs than actually people who actually receive no welfare. So in conclusion, we saw that welfare was meant to be temporary. At first, it's always meant to be temporary, and you can see now that more people are using welfare more than ever before, and people are using it and saying that, hey, if I keep having kids, they're going to keep giving me money. If I stay in this, they're going to keep giving me this and that and everything. And then people are still abusing it today, and also people are also on the government side, they're not doing what they should be doing to make sure that people are getting what they need and verifying that this is this type of person. So some of the solutions that have been done so far is drug testing. Another one is making stricter regulations so people can't abuse it and all that stuff. So like I said, I hope this takes into account of what has happened, and then hopefully we can do something about it. Thank you.